So it's basically a collagen matrix inserted into the shoulder. This is deployed, it opens up like this and sits on top of it. Press on the trigger and you'll see this come through. My name is Ali Noorani. I'm a shoulder and elbow surgeon and I am at OS. Today we're going to be talking about a technical video on how to use the Smith & Nephew Regeneten Patch. The Regeneten Patch is a collagen patch that has at least a 10-year history of use in clinical settings, and there has been quite a bit of randomized controlled trials as well as basic clinical trials done to show that it improves cuff healing rates, improves the patient outcomes, and today what we're going to talk about is how to use this in practical sense. As you may know that rotator cuff problems are a very common source of pain, weakness and generalized dysfunction, especially in the patients who are over the age of 60 years old. If I go back looking 20 years ago, we hardly did any patients over the age of 60, and now my common patient will probably be in their 70s and sometimes even the 80s as well, because there's a lot more demand from the patients to remain active and functional, and we are here to help patients achieve that. So gone are the times where we say, give up your sports and so on. Today what we're trying to do is make sure that the patients can get back to those activities so they can continue to live a healthy and happy life. And one of the things that we need to do that here is to make sure that when we do rotator cuff surgery in those people, that we make sure or actually improve the healing rates so that they can actually achieve those goals. As the patients get older and as the tear gets chronic, the healing rates of those tendons have been shown to be decreasing. So what we do here is to improve techniques and enhance the healing rates. So we know in today's world, our population, friends, family, as we're getting older, we want to stay very active. I have enough patients, including my mom, who wants to continue lifting weights, my dad who wants to continue boxing, even though they're approaching 80. This would not be seen normal in somebody who wanted to do this 20 years ago, 30 years ago. But we also know that biology catches up with us. And we know that rotator cuff tears are very common, especially if you are above the age of 60. Luckily, a lot of people have rotator cuff tears, but they don't get many symptoms from it. But there are quite a few that do get symptoms. And in those patients that have symptoms, we can treat most patients non-operatively using conservative techniques. But there is a specific group of patients that do require surgery. And if they are a particular group that requires surgery, it is our duty to make sure that we can improve the healing rates as much as possible. When we talk about several ways of improving healing rates, this involves specific techniques, but it also involves enhancing the cuff repair with patches like the collagen patch that we're going to talk about, the Regeneten Patch. Now in research, which is including basic science research, but more importantly in randomized controlled trials comparing patients who've had cuff repairs with the patch and without the patch, there has been evidence to show that with the patch, patients do better. They do better from an increase in healing rates, lower re-tear rates, improvement in patient outcomes. So today, we're going to tell you about how we use this patch in a technical scenario. We're going to show you all the different instruments that we use, how to insert this patch. And at some stage we will talk about what the patient choice is when using this patch as well. So when patients have symptoms of rotator cuff problems, actually what's interesting is when patients have rotator cuff tears, quite often they don't have symptoms. The rotator cuff is a cuff of tissue deep inside the shoulder that goes from the front, back and top. So you have a cuff of tissue that goes all the way around. And I like to ask my patients to visualize a rotator cuff almost as a curtain that goes all the way around and is attached with hooks to the railing. And if you can imagine a curtain, and imagine the curtain actually losing some of the hooks. Losing some of the hooks would be the same analogy as getting a full thickness tear. The hook has come off the railing. Now, just like a curtain, if the hooks are lost somewhere in the middle, you may not even notice it. And there's a lot of patients who have rotator cuff tears that have selective loss of tendons in particular areas where the rest of the shoulder compensates quite well, and they may not have any symptoms at all. But there are some patients where they lose it in a particular area. And the analogy of the rotator cuff being similar to a curtain is, in a way, similar is because if you lose the hooks on one side, then you know the curtain droops. Or if you lose too many hooks, again, the curtain becomes dysfunctional. So think of a rotator cuff as that. Where you lose the hooks on the curtain and how many you lose makes a problem. Once you get to a critical position or a critical number of hooks that have gone, the rotator cuff, similarly the attachments, if they're enough torn or if they're torn in a selected position, then you can start getting symptoms. The typical symptoms would be pain. It is one of the most common reasons for shoulder pain in the over 60-year-old. So if a 60-year-old comes in my office and says I have shoulder pain, I would probably guess they have a rotator cuff tear. The pain is usually on the side of the shoulder. We call it the anterolateral side of the shoulder. So pain is the main function, and quite a few people complain of night pain as well. So it's a common symptom to get pain at night. Now you can imagine that the rotator cuff is a tendon. So a tendon is something that attaches your muscles to your bone. So it's a mechanical structure. Now, yes, it can cause pain, but if the tendons are not attached to the muscles and the bone, then eventually you will get weakness as well. So the muscle contracts, is pulling on this tendon, but the tendon is not actually attached to anything, hence you can get weakness as well. So in some cases, they'll have pain when lifting up the arm. In some cases, they will not be able to lift up the arm and they'll use the wrong muscles to kind of hitch up their shoulder. So generally speaking, pain is a predominant symptom, followed by weakness. So we're going to talk about the kit as it comes to insert and deploy the Regeneten patch. So this is what a patch looks like. So it's quite small, quite thin, and it's a few millimeters thick. Structurally, you can rip it apart. It's very porous, but it's strong enough to augment the cuff repair. This is made up of a Achilles bovine collagen. It is acellular, so all the cells have been removed. So it's basically a collagen matrix. The blue coloration is obviously when you're doing it arthroscopically to tell you where the boundaries are, but the whole thing is a collagen patch. But it doesn't come like this. What it does come is conveniently in a gun that looks like this. So here is a tube on the outside that allows you to insert it into the shoulder once you have repaired your rotator cuff, and the patch is rolled up. And in a short while, when we're demonstrating on the kit, I'll show you how we deploy this and open it up. But once it's deployed, it opens up like this and sits on top of the tendon. So once the patch is in, what we want to do is actually stabilize it. Now, very important as a technical tip, put these cannulas in before you put the patch in. You don't want to be fiddling around. Now, the cannulas can you put in any direction you feel that you want to get the control over the patch. But in most cases, in my practice, most of the clips that we use are put through a cannula that is either through the anterior or the anterior lateral portal. So the front two cannulas are where I do most of my work from. So this is the introducer that comes in, the cannula goes in through a port, this comes out, and this is, as you can see, is not completely round, it's actually slotted in such a way so that when you deploy your clips, you can only go in a certain direction. So what's next? When we are stabilizing the patch, we need to stabilize them with certain implants. you can see these little tiny purple things, right? These are staples. They're not like real metal staples that we use for putting papers together, but these are very sophisticated bioabsorbable staples. So what that means is that we can put them in to put on top of the patch, which is sitting on top of the tendon, so it holds down onto the tendon, and over time these staples dissolve, so that they disappear. And I'll show you how we take them out and deploy them, right? So these come with staples, and usually there's a pack here which has 8 staples, which is plenty for one Regeneten patch. Often I use 4 to 5, but if you need more, the reps always have a spare box like this. So this is a introducer for the staples, but it also grabs the staples from these boxes. So it has little prongs on it. And what we do is we look at that slot and we push it in, and then we squeeze the trigger. It grabs that staple and brings it out. And if I now squeeze it out, should come out quite easily. There we go, a little bit hard, but you can see there's a purple staple deployed, ready to be deployed in the shoulder. We're using this for attaching the Regeneten patch onto the bone. So when you attach the Regeneten patch, ideally what you want is most of it is sitting on your tendon, which you fix with your bioabsorbable purple clips or staples. But the edges which are on the bone, we use these PEEK, which is also a plastic, pins, staples to fix those. Because on the bones, you can't use the purple ones. So I'm going to show you how that is fixed as well. So the first thing that you do is you, like any kind of gun, you take the safety off, okay? And as you took the safety off, you see these little prongs come out, yeah? And here are the clips that we use. You can see the whitish brown tips. These are the PEEK staples that we use to stabilize the Regeneten patch onto bone. And the best way to do this now is to demonstrate this on a model. Good. So this is just a model to demonstrate the shoulder, right? Or the deeper part of the shoulder. So imagine that's your humerus, the end of your shoulder bone, and that's your supraspinatus tendon. It looks nothing like this in the real world, but this is a good demonstration. And when the patch goes in, and presuming you repaired the tendon, in this case, you will be putting the patch on top. So part of the patch will be on the tendon and part of it will be on the bone down here. And what we fix here is with the purple stuff, and what we fix here, which is the brown PEEK stuff. The reason we use different ones is that the purple one, the bioabsorbable ones, are connecting the tissue to tissue, right? And they absorb with time. When you want to connect it to the bone staples, the PEEK ones, are much harder plastic. And you can't use the purple ones because they won't go into the bone. So you want something solid that can go into the bone. And hence, we use the PEEK white, brown plastic ones for the bone, and the normal, softer PLLA purple ones to connect the tissue to tissue. So we're going to imagine this. This is the outside, the lateral portion. This is the back of the shoulder. This is the front of the shoulder. And like I said, we are often going in from the side to put the patch in. But before we do all of that, this is obviously done all keyhole surgery, all arthroscopically under a camera inside. We're not making any big cuts or anything. So you want to make sure that you have these cannulas in place to push it. And like I said, the anterior cannula, which is in this position, or the anterior superior lateral cannula, which is in this position, is a good cannula to kind of get all your different things. So I'll just turn it around so you can see it as well. So if the cannula comes in from the front, you're easily able to get all of those things, okay? So we position the cannulas in before we put the patch in. But for today's purpose, we will not be using this because we're not doing a keyhole, we're doing an open demonstration. It comes in a shape like this. That's the patch inside. There's a little plastic tube on top, and you'll be going in through the skin and going into the shoulder. And right now we can imagine that we are inside the shoulder like this. So then you press this button down here, and what this does, it takes the safety off, Okay, all guns have safety. And then you press on the trigger and you'll see this come through. So this patch is very similar to the other patch that is right there. So the patch that we have here is a medium-sized patch. The patch that we have is a large-sized patch. We choose the patch depending on the patient's size. Most of the time it'll be a large size. What you see is these prongs gently holding the patch opened up in a nice position and firmly allowing you to place it with this gun type device on top of the tendon. So you will be holding it there. Now your assistants kind of hold it in the right position. You don't want it too much up here or too much out here. You just want to choose where you want to be. So we're going to choose today to have a patch right down here. And now the next step is going to be for us to show you how we stabilize this patch. Once the patch is in the place, we're coming in through the cannulas with the purple clips that we had loaded up before. And oh, that's a perfect position. And I'm just going to go in, I'm going to push it through, and then I'm going to squeeze on my trigger. And what you'll see is that little purple staple has stuck that tendon patch on top of my rotator cuff. Then we take the next one and coming in through the cannula again, through a slightly different position, stab it through, squeeze the trigger, and it kind of holds in position. So we've done 2 bioabsorbable purple staples in already, and I'm going to put in a couple more. One down here, here we go, and one down here. That looks like a good spot. Perfect. Now that we put 4 in, it should be stable. Now sometimes I use 5 and so on, but I feel right now that with those 4 really good staples, the tendon is held in place. The next thing that we do is we just drop your hand and just gentle wiggle, 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 and keep on wiggling. Usually it's a little bit easier. There we go. So this thing has now come off. It is no longer holding the patch. I've never had one that pulls the patch off. So once you have 3 or 4 staples in, it's actually pretty secure. Now what we can see is that this patch is actually pretty firmly fixed, yeah? It's not going anywhere. It's nicely on it. Now you may want to put in a few more purple ones on the tendon if you want to have a bit more security, but for this medium-sized patch we think we're enough. But as you can see, the lateral side, the outside, is still a bit floppy because we haven't connected to the bone yet. So the next thing that we're going to do is demonstrate how we use it to connect it to the bone. So once again, safety off, prongs come out, and now we're going to get a close-up of how this is done to the shoulder. Yeah. So we're coming in and we find safety obviously will be off, and we'll be coming in through our cannula, through the patch into the bone. And here somebody's got to use a mallet to bash it in. This down, what we do is you press on the trigger, and what it does is it kind of takes the back bit out. We now load the peak staples through, keeping it nice and steady. Let go of the trigger, and then somebody bashes it from the back again. Good. It's down, and you click again and you're out. And what you can see as a close-up is that little peak staple is now connecting this to the bone. You can see we haven't fixed this side, it's a little floppy, but here is firmly fixed down to the bone. So it's basically a collagen matrix inserted into the shoulder. This is deployed, it opens up like this and sits on top of it. Press on the trigger and you'll see this come through.